44 years age group in Meghalaya to receive COVID vaccine jabs from tomorrow, announces Chief Minister Sangma. Arunachal Pradesh to raise number of oxygen beds, says Chief Minister Pema Khandu, grants 66 crore rupees fund booster for COVID expenses. Assam Chief Minister Himanta Biswa Sharma reviews COVID scenario in Majuli, orders stringent measures for control of infection. Meghalaya seeks more manpower from centre for NEGRIMS for stronger resistance to COVID pandemic. And Tezpur University students design portable ventilator for fighting corona ferocity. A very good evening, viewers. Welcome to the Northeast News Bulletin from the studios of DDK Guwahati. This is Sukanya Bharadwaj. And now the stories in detail. In news from Northeast first, in Meghalaya, Chief Minister Conrad K. Sangma has announced that vaccination against COVID-19 for the age group of 18 to 44 years will commence in the state from tomorrow. In a tweet, Sangma said that altogether 42,000 doses of the vaccine ordered by the state government will arrive any time now. The vaccine is earmarked for vulnerable districts and the health department will strategize the vaccination drive. Earlier, Deputy Chief Minister Preston Tingsong said the Meghalaya government has already sent a letter to further extend allotments of vaccines to the state. In Arunachal Pradesh, Chief Minister Pema Khandu today reviewed the status of oxygen in state hospitals. Later, in a tweet, he informed that by month end, the state will have 500 oxygen beds with 7 oxygen generation plants functioning. He said he has directed concerned officials to work for raising the number of oxygen beds to 1,000 with additional oxygen generating plants. Meanwhile, in another tweet, Khandu said that pursuant to the decision of the State Disaster Management Authority for effective management of COVID-19 pandemic, 66 crore rupees of the State Disaster Response Force has been released to the Health Department and all Deputy Commissioners for COVID-related expenses. Bharat Biotech has been granted permission to conduct phase 2 and 3 trials of COVID vaccine Covaxin for the age group of 2 to 18 years. The expert panel of the Central Drug Standard Control Organization has recommended the conduct of the trials. The Drugs Controller General of India has accepted the recommendation of the subject expert committee. The trial will be conducted on 525 healthy volunteers. During the trial, 2 doses of the vaccine will be administered to the volunteers. Gap between the first and the second dose will be 28 days. The trial is aimed at evaluating the safety and immunogenicity of Covaxin in children aged between 2 and 18 years. In Assam, Chief Minister Dr. Himanta Biswa Sharma reviewed the COVID-19 situation at Majuli with Member of Parliament Pradhan Barua, Deputy Commissioner Majuli and other senior officers. He asked officials to take strict measures for containing the pandemic. On a visit to the River Island, Dr. Sharma instructed Deputy Commissioner Majuli to ensure maximum number of COVID testing while going in for mandatory testing in all entry points of the district from tomorrow onwards. He also reviewed the status of ongoing development schemes in the district with the Deputy Commissioner and the district heads of the concerned departments while stressing timely completion of flood control measures.
Gormur Amar Dokhin Pathatra আউনিয়াতি ক্ষত্ৰ আৰু নতুন কমলাবাৰী ক্ষত্ৰলৈ গৈ আমাৰ প্ৰভু ঈশ্বৰসকলক সাক্ষাৎ কৰা আৰু ভাৰতীয় জনতা পাৰ্টি অসম গণ পৰিষদ
More than 17 crore 72 lakh COVID vaccine doses have been administered in the country so far. Union Health Ministry has said that more than 18 lakh 94,000 beneficiaries were inoculated with vaccine doses in the last 24 hours. Meanwhile, a total number of 3 lakh 62,727 new cases were reported in the country in the past 24 hours, taking the cumulative positive cases to over 2 crore 37 lakh. The ministry said 4,120 deaths were also reported during the last 24 hours, taking the toll over 2,58,000 across the country. India's COVID-19 recovery rate now stands at 83.26%, with the recovery of more than 3,52,000 patients in the last 24 hours. The ministry said that more than 1,97 lakh patients have already recovered from this disease. Presently, the total number of active cases in the country is over 37 lakh 10,000. In the COVID scenario from the northeast, Arunachal Pradesh reports 2,094 active cases, while discharged cases logged at 18,691. The tally for the dead is at 69. Assam is saddled with 40,970 active cases, while the cured cases logged at 2,65,860. The dead accounted for 1,909. Reporting 5,272 active cases, Manipur recorded 31,238 cured cases, while the dead tallied at 526. Meghalaya reported 3,381 active cases, with a caseload of 17,354 cured cases. The dead accounted for 250. With a caseload of 2,033 active cases, Mizoram logged at 6,120 discharge cases, while the death toll is 23. Nagaland reported 3,297 active cases with 13,428 released cases. The dead tallied at 165. Sikkim has a caseload of 2,866 active cases, 7,366 cured cases. The tally for the dead is 183. Lastly, in Tripura, active cases have touched 3,684, while discharged cases logged at 34,946. The dead accounted for 424. In Meghalaya, Health Minister A.L. Hek on Wednesday visited the Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences, NEGRIMS, to encourage the doctors and healthcare workers to keep up their fight against the pandemic. He said the state government is trying to get more manpower for the hospital. Hek said the state government has urged the centre to provide more manpower to the Premier Medical Institute, and a decision from New Delhi is currently awaited. The minister interacted with the doctors and healthcare workers and assured them every possible support from the government. He said NEGRIMS authorities will get all kinds of support and cooperation from the state government. During the visit, he was accompanied by NEGRIMS director P. Bhattacharya and other senior doctors.
They have kept the other ICU separately. All has been made arrangement. We are very, very happy. Then also they said that there is no problem with the oxygen, that there has no problem with the beds, no problem with the ventilator at present. Everything it be manageable.
In Assam, in response to the prevailing shortage of ventilators, the Department of Electrical Engineering, Tezpur University, has undertaken an initiative to design a portable ventilator. The initiative was part of a project awarded as the Best Innovative Engineering Idea under the banner of Professor Aparna Kumar Padmapati Annual Scholarship from Assam Engineering College Class 88 Foundation for year 2021. A group of electrical engineering students comprising Bihung Mushairi, Aniket Raj, Manish Kumar and Ankita Das are working in the project under the guidance of Siranjit Adhikari, former guest faculty, Department of Electrical Engineering, and Firdausa Ahmed, guest faculty of Department of Electrical Engineering. The project is being supervised by Professor Somik Roy, Head Department of Electrical Engineering. Ankita Das explains.
So people, like, it's 15,000, but if we improve some more features, then it will be again, like, if it will be nice for us. Then so people can buy this prototype. This is just a working prototype, so after that it will be like a full product like that. So we can, like, implement some more features, and if people also come to, like, give us more support and continue this initiative, then definitely it will really work.
The union government is continuously engaged in the allocation and supply of medical equipment and medicines to the states and union territories received from various countries. Union Health and Family Welfare Ministry has said a total of 9,284 oxygen concentrators, over 7,000 oxygen cylinders, 19 oxygen generation plants, 5,933 ventilators and BiPAP machines, and more than 3,44,000 remdesivir vials have been dispatched to the states and union territories. The National Technical Advisory Group on Immunization (NTAGI) has recommended an increase in the gap between 2 doses of Serum Institute of India's Oxford COVID-19 vaccine Covishield to 12 to 16 weeks. Currently, the interval between 2 doses of Covishield is 4 to 8 weeks. The panel has, however, kept the dosage interval for Covaxin unchanged. It has also recommended that those who have tested positive for COVID-19 and are awaiting to take the vaccine should defer vaccination for 6 months after recovery. It said pregnant women may offered the choice to take any COVID-19 vaccine, and the lactating women can be inoculated anytime after delivery. Meghalaya Home Minister Lakmen Ringboi has informed that the State Cabinet has approved a proposal to restructure the Special Force 10 in an effort to extend their services to other parts of the state. Speaking to reporters in Shillong, the minister said that due to reduced militant activities in the state, the SF-10 personnel will be transferred to other districts to curb other crimes.
So we know that the strength of the SF-10 approved by the Cabinet is 1,784. And the actual strength as of now is 1,387. So we want to restructure it in such a way that 905 will remain in SF-10, and the rest we could transfer to the district or to any outpost.
To end the news main points once again. 18 to 44 years age group in Meghalaya to receive COVID vaccine jabs from tomorrow, announces Chief Minister Sangma. Arunachal Pradesh to raise number of oxygen beds, says Chief Minister Pema Khandu. Grants 66 crore rupees fund booster for COVID expenses. Assam Chief Minister Himanta Biswa Sharma reviews COVID scenario in Majuli, orders stringent measures for control of infection. Meghalaya seeks more manpower from Centre for NEGRIMS for stronger resistance to COVID pandemic. And Tezpur University students design portable ventilator for fighting corona ferocity. Before taking leave, viewers are reminded to maintain physical distancing, regularly sanitize hands, and frequently wash hands with soap. Remember to wear a mask properly and join the Mask Up India campaign by Doordarshan to defeat the pandemic. That brings us to the end of this evening's bulletin. Thank you for tuning in. Namaskar.